Hello friends, I am here to present you with some fun mnemonics related to color coding which is indirectly very useful for might it may be for the NEET PG, FMG or INICT. Here comes the first mnemonic for the IV cannulas, as you know that this is very important topics. First, our color mnemonic is like picture which I am representing here. Firstly, underground there is a lava which is of the orange color. Then it above it comes the soil which is of the gray color. Above it, grass which is of the green color, and above it there is a pink flower, and above the pink flower there is a sky, and above the sky there is yellow color sun. Just like this picture, the first is the orange color cannula, then there is a gray color cannula, then there is a green color cannula, then there is a pink color cannula, then there is a blue and the yellow. The starting number is related to 14, whether it may be a IV cannula or Foley's catheter. My mnemonic is that the first catheter or the first Foley's is always the 14 number Foley's. As we are representing from the lava which is of the orange color, that means orange cannula representing the 14 gauge. Then gray cannula, increase it with the even numbers, then 16 gauge. Then green color is of the 18 gauge, then pink color is of the 20 gauge, blue color is of 22 gauge, and yellow color is the 24. As the number increases, the size of the cannula decreases. Therefore the yellow cannula is used for the neonates which have the smaller flow rate, and the orange, green, or whether it is the gray cannula, it is used for the trauma. Therefore this picture is very important, that is from below upwards there is a orange color, then soil which is representing the gray color, above it there is a grass which is representing the green color, above is there is a pink color flower, then sky which is of blue color, and yellow which is of yellow color. Then next, as here shown, that orange representing the 14 gauge, then increase it with the even number, that is 16 gauge, 18 gauge, 20 gauge, 22 and 24. Then maximum flow rate. The flow rates are important for the INICT exam, as I had told you that as the number increases the flow rate decreases. Just like the yellow color gauge has the highest number which is at 24, therefore it means it has a smaller rate, that is the 13 flow rate, 13 ml per minute. And as you increases, approximately remember that 30 is stable, that is 30, 60 and 90, representing the, for the blue cannula it is the 30 milliliter per minute, for the pink it is of the 60 milliliter per minute, and green of the 90 per minute, and highest is the orange which representing the 270. The maximum flow rate is, you can remember approximately values which is of the 30 table. First there is a 13, then 30, 60, 90. It will be solved. Then these are the color coding mnemonics for the IV cannula. Then next will be Foley's catheter. There are many color like black, violet, purple. You don't have to remember such large amount of the numbers. You have to remember only four from my point of view. That is, my mnemonic is GORI. GORI meaning G for green, O for orange, R for red and Y for yellow. And as I have told you that my mnemonics either it may be for the IV cannula or it may be for the Foley's catheter. It is always starting from the 14 number. So for the green color it is a 14 French, orange color it is of the 16 French, red color it is of the 18 French, and yellow color it is of the 20 French. Then what do you mean that the French represents? French is representing the external circumference of the catheter. It is very important. It is asked in multiple examination that French of the Foley's catheter representing the external circumference of the catheter. And latex Foley's is for can be used up to the 1 week, and silicone Foley's is used up to the 6 weeks. Then this is the mnemonic for IV cannula and the Foley's catheter. Next, our our mnemonic is for the vacutainers. Then my mnemonics are red. Red is like a dangerous color. Dangerous means no one can enter it being, therefore there is no additive. You can represent that red is for the danger color and there is no additive. Green. Green representing the hara color. Green in Hindi means hara, and hara is relatable to the heparin. Therefore, green vacutainers representing the heparin. Then lavender color, as you know that for the CBC we are using the EDTA bulb. In lavender itself it is representing the E and D, that means the EDTA. Then gray. Gray color is for the E, F, G. These are the mnemonic for the gray color. E is for the enzyme, that is the enolase enzyme. F for the fluoride and G for the glucose and also for the gray color. It means that in case of the green color vacutainer, I'm sorry, in case of the gray color vacutainer, we are collecting the samples to measure the glucose level, which contains fluoride as the substance and which inhibit the enolase enzyme. So you can remember it by the EFG. Then light blue. Light blue meaning, as you remember that when we are the students, the PT is done with the blue color, light blue colored dress, and our PT teacher representing 1 2 3 number. Just like remember that PT is synonym to CT. PT CT, then that is mean PT representing the PTINR and CT representing the citrate. Then black. Black is ganda. Ganda is like ishar. Ishar matlab ESR, matlab black is representing the ESR. Then gold. Gold is the tasty. Gold mnemonic is tasty, where SST is representing the serum separating tube and Y representing the yellow colored tube. And pink color, when you are a childhood, you play the games like pinky pinky what color. What color means you are cross matching the colors of each other. It was a game of the student class, therefore pinky pinky what color representing the cross matching. Then we can again revise it by that red color. Red color meaning see there is no additives. Green. Green representing the hara. Hara meaning the it is synonym to and it is approximately similar to the heparin, therefore it is a heparin tube. Then light, there are two colors of the green, that is light green and dark green. Light itself representing the lithium and dark D itself representing the sodium. Then lavender. Lavender name itself containing E and D, that means the EDTA bulb, and it is used for collecting the CBC. It causes clumping of platelets, therefore it is not used for measurement of platelets. These are the questions of the NEET PG, that which tube does not measure platelet, which is the EDTA tube, which are used for responsible for measuring the CBC count, heparin, everything, but not for platelet because it causes clumping of platelet. Then gray color heparin tube is EFG, that is E is for the enolase, F is for the fluoride and G is for the glucose. Then light blue color means CT, PT. CT is for the citrate and PT is for the INR. PTINR, you know that PTINR is used for the clotting factors measurement, that is the PTINR, prothrombin time. Then black is Ganda is Ishar meaning ESR for the measurement of ESR. Then gold meaning yellow color, that is the gold is just like yellow color and it is representing by the mnemonic, that is tasty. ST means serum separating tube and Y is the yellow color tube. Then and it is also used for measuring the platelets. Platelet count is measured in case of the heparin tube or the citrate bulb is used. For the platelet count, either heparin bulb or the citrate bulb can be used. And pinky what color, that is used for the cross matching. Once again we can revise this, that is our mnemonics are red contains no additive, it is used for the immunology, serology or some others test. Green is for the heparin tube is also used for measuring of the platelet count. Lavender is used for CBC and its name contains itself, it is a EDTA substance. Gray is EFG, G, that is E for enolase, F for fluoride, and G for glucose. Light blue meaning CT, PT meaning PT INR, and CT meanings the citrate. Then black color is for the ISHR, it representing ESR. Then gold, that is tasty, SST, that is serum separating tube. And pink is means what, pinky what color. Remember that the lavender color tube, EDTA tube, causes clumping of the platelet. Therefore, platelet is measured in heparin and the citrate bulb. Citrate is also for the PTINR, CTPT, and heparin is also for the counting of the platelets. Then our next topic is triage. Triage, as you know that the rainbow have the 7 color which is representing by the whipjaw. Here also we are just like the 4 colors. R is for the red, Y is for the yellow, G is for the green, and from B it is in case of the rainbow, B representing the blue color, but here B representing the black color. As you know that black means which we can't do anything, and we are given the least priority for the black color, that is the dead or morbid patient, which if we invested so much time in that, there are many patients which can be saved. Therefore it is called as a morbid patient, which we cannot help towards this patient, which contains severe brain injury, major damage for the chest wall and the abdominal structure. Then green are given lowest priority, which only needs the dressing of certain substances like the if it contains the simple fracture or minor laceration. Then yellow color is for the substances which can be possible resuscitation or the surgery in the next 24 hours. And the red color, which are given highest priority, if we invested the time in this patient, it can be saved easily. And it contains the tension pneumothorax, airway obstruction, hemothorax, cardiac tamponade, acute circulatory arrest, and major intra-abdominal bleed. Listen, it is very important topic. Therefore, please take this mnemonic very seriously. Then we are again revising it. For IV cannula, there is a firstly is of the orange color, which representing lava. Above it there is a soil, green color, grass, pink color is a flower, sky is for the blue color, and sun is for the yellow color. Then representing Gori for the Foley's catheter, where G representing the green, O is for the orange, R is for the red, Y is for the yellow. And for both there is a even number starting from the 14. Then for the vacutainer, as red representing there is no additive, green is like hara is for the heparin, lavender itself representing EDTA, gray EFG, that is E for enolase, F for fluoride, G for glucose, light blue PT, CT is for the citrate, and PT is for the PTINR. Black color is ISHR, ESR, and gold and yellow is SST, tasty, that is serum separating tube, and pink is for the cross matching. Then whipjaw R is for which is given the highest priority. Then yellow is given medium priority. Green, this question is asked multiple times, that green is for the ambulatory patient. Which are the patient, which color coding is given for the ambulatory patient is a green, which is also contains the lowest priority patient. And black is for the morbid, it is also asked multiple times, that is black representing the least priority patient. Thank you so much. Please like, subscribe, and share with your friends. Thank you.